Aloha guys, this is Dr. Tom Walker coming at you again. Today we're going to study the digestive system. But first, I want you to, if you're so agreeable, I want you to subscribe to my YouTube channel, like all these videos. Buy my book, The Force is With Us. You can get it on Amazon for about 15 bucks used, sometimes 2 or 3. All right, now, the digestive system. Moving right along. What does it do? Well, we ingest food, then we digest it. Mechanically by chewing and the stomach, and by chemically by the use of enzymes. Then we absorb the nutrients, and then we excrete the waste. Okay, starting from the top, here's the digestive system along with some of its accessory stuff as well. We got the mouth, salivary glands, pharynx, the esophagus, which is the tube we swallow food through, down to the stomach. Then it goes from the stomach, goes into the small intestine. This is where most of the digestion and absorption takes place. Then the large intestine, which is frequently called the colon, and out the rectum and the anus, the waste products. The liver also plays an enormous role, the gallbladder, and the pancreas. The pancreas lies posterior to the stomach, so it's a little harder to see. Okay, there are waves, guys, that occur in the smooth muscle, and they're called peristaltic waves, or peristalsis. I'm sorry, let me get this thing adjusted. Waves of muscle contraction relaxation pushes food from the mouth towards the anus. So rings of this stuff, guys, run down through the intestine, and it moves everything along. Peristaltic movements differ from organ to organ, particularly in the intestines. 4 layers of the digestive tract. Mucosal layer, submucosal, muscular layer, and serous layer. Okay, let's see. Remember that any opening or tube in the body or organ that communicates with the outside environment, guys, is lined with mucosal epithelium or mucous membrane. And the digestive system is no exception to that. So we have mucosal, submucosal, muscular layer, and an outer serosus or serosal membrane. Peritoneal. Okay, let's see. These muscles are the ones that cause the peristaltic waves, so they're real important. We have them going circularly, the fibers, and longitudinally like this. Let's see. And then the inside is lined with epithelium, different types of epithelium depending on what part of the GI tract, the gastrointestinal tract we're at the time. Oral cavity. Teeth are for mastication. Mastication is a medical term for chewing. Tongue used for swallowing in as far as digestion. Salivary glands, we have 3 pairs. They're located bilaterally. The parotid glands, which are the biggest, the submandibular, and which is on the jaw, and the sublingual, which is up closer to the tongue. Digestion of carbohydrates, guys, starts in the mouth. There's an enzyme that starts breaking down carbohydrates in the mouth called ptyalin. Okay, so here's our incisors, cuspids, bicuspids, molars, palatine tonsils, soft palate, hard palate. Okay, the anatomy of a tooth. Teeth are very important, but they just never have particularly interested me, but they sure do if you get a toothache, though. Parotid glands, again, here's the salivary glands. Lies anterior to the ears, largest 3 glands. Mumps virus affects these glands. Submandibular, located on the floor of the mouth. Sublingual, located under the tongue. Sublingual, under the tongue. This is the smallest. Eating and swallowing. Mouth, pharynx. Pharynx is basically the throat. The esophagus is the tube that runs between the throat and the stomach. The stomach has 2 sphincters on it, guys, that tighten up because the stomach milks and churns this stuff after we've eaten and or chewed and swallowed it. And to keep it from squirting back out, these sphincters tighten up. So there's a lower esophageal sphincter, and they go by a couple different names, so it gets a little confusing. Let's wait till we get to the stomach. Here's a cross section. Mouth, tongue, epiglottis. Remember, the epiglottis seals off the airway so we don't accidentally swallow food down into the respiratory system, which could set up a very serious infection and even be fatal. The epiglottis. Sometimes we swallow it anyway, but it does a pretty darn good job most of the time. The stomach. Okay, here's the esophagus coming. Here's the lower esophageal sphincter. It used to be called the cardiac sphincter because it's close to the heart. I like that better. And then at the end, here's the stomach. There are three parts, the fundus body and the pylorus. And then it goes through another sphincter into the small intestine called the pyloric sphincter. Now, that's located in the pyloric section of the stomach. So we also have a greater curvature of the stomach and a lesser curvature. The duodenum, and that's how that's pronounced, is not duodenum, it's duodenum, is the first section of the small intestine. Stomach regulates rates of gastric emptying, secretes gastric juice, including hydrochloric acid. Yes, the acid in your stomach is as strong as the battery acid in your car, and it's supposed to be that way. Secretes gastric hormone, intrinsic factor, enables us to absorb vitamin B12, which is necessary to prevent anemia. Digest limited amount of food. Protein digestion, guys, starts in the stomach. Hydrochloric acid plays a big role in that. So, and some limited absorption. Alcohol, for example, is absorbed in the stomach. The interior of the lining of the stomach is in rippled ridges called rugae. Probably wouldn't hurt to know that. That would be a pretty good test question. Okay, now we pretty much answered all these. Lower esophageal sphincter, pyloric sphincter, fundus body, pylorus, greater curvature, lesser curvature. First part of the small intestine is called the duodenum. Look, it has three layers of muscle, a longitudinal layer, a circular layer, and one going at an angle called the oblique layer. Why? It mixes and mashes up all this stuff. It's what we haven't already mashed up when we're chewing. When you get that ball of food all chewed up and mixed with saliva, that's called a bolus. I haven't seen that term here, but that's what it's called. And in the stomach, it gets mixed and mashed and becomes chyme, this word. And then the stomach has some peristalsis in it too. Remember, when all the churning goes on, the two sphincters close up. If they don't, a lot of people have acid reflux or GERD and stuff. It's because this lower esophageal is not sealing properly. And the stomach contents are splashing up into here, and it's extremely sensitive. And the contents are highly acidic. Okay, stomach structure, mucosa. Here's all the rugae, mucous membranes. Mucus protects, we have a lot of mucus in the stomach, protects from the stomach acid. Guys, we have to have the acid, but we have to protect from it too. Parietal cells make hydrochloric acid, makes intrinsic factor, which enables us to absorb vitamin B12 from our food, which prevents having pernicious anemia. Sort of, I didn't say pernicious anemia, but I said that a moment ago. Chief cells, that's their name, make digestive enzymes. Pepsinogen turns into the enzyme pepsin when activated with hydrochloric acid to help digest proteins. Carbohydrate digestion begins in the mouth. Protein digestion begins in the stomach. Clinical conditions. Gastric ulcers are quite common. They found that most of them are due to H. pylori bacterium. See, guys, they thought, well, there's no bacteria lives in the stomach. It's too acidic for them. But they found out, yeah, it is. I was working in family medicine a little over 20 years ago when the bulletins first came out. And so, bingo, they found they could prescribe specific antibiotics and treat these things successfully. Here's showing a hiatal hernia, very common. Here's the diaphragm. There's a hole in the diaphragm because the stomach is inferior to it for the esophagus to go through, but for some reason, a lot of times the part of the stomach will work its way back up through there. That's called a hiatal hernia, and it can cause some, digestive problems. Here's the word. Nasogastric tube, they use for different medical procedures. Ostomy, where's that? Here. They have to put nutrients directly into it. Pyloric stenosis, where the pyloric sphincter is too small or doesn't open up enough. You see this sometimes in small infants and all. Vagolytic, let's see, anticholinergic meds, atropine, dry secretion, and weight loss. Okay, weight loose. I think they meant loss. Okay. It's also gastric carcinoma cancer, which is fairly common. Small intestine, first part's the duodenum. There's three parts of small intestine. It's 20-something feet long. The duodenum, the jejunum, and the ileum. Here's the words. They're in purple here. Ileum. The ileum articulates. That's not the right word. Anastomoses, perhaps, with the colon. Function: digests, absorbs, secretes hormones, and digestive enzymes. It has all these little villi, guys, and this is called a brush border. Greatly increases the surface area. Most of the digestive enzymes come from the pancreas, most of them, and they're released into the small intestine, but the small intestine has some too. This provides enormous surface area for digestion and absorption. Here's a picture of one. See, we have a vein, artery, capillary, and these are called lacteals. Now I can't use the excuse I'm tired today. Lymphatic vessel. Doggone it. Here's a villi and a microvilli. Folds increase area for absorption, increase surface area. Insides compose capillaries and lacteals. End products of digestion delivered to the hepatic portal system and the lymphatics. It's called chyle. So it's a bolus, chyme, and a chyle. Okay. What's this do? Provides great surface area for digestion and absorption, both of which primarily occur in the small intestine. Here's the large intestine, or colon. Here's the appendix. The first part of the colon that articulates, that joins onto the ileum of the small intestine is called the cecum. Now, the colon, we have an ascending colon, a transverse colon, a descending colon, and a sigmoid colon, which is shaped like an S. Here's the rectum and anal canal. So this goes up the right side of the body across and down the left side. Here they are here. It's a large intestine, but I think it's more commonly called the colon. Functions: absorption of water and certain electrolytes. Synthesis of certain vitamins by intestinal bacteria, for example, vitamin vitamin K, which plays a crucial role in blood clotting, is synthesized by bacterial action in the colon. 30% of the fecal content of the stool, the poo-poo, is bacteria. Temporary storage of waste, elimination of feces, waste, and gas flatus. The average person expels 500 milliliters of gas a day. I wonder how they found that out. Did they follow someone around? No, I'm not going to speculate anymore because I don't want to know. Most digestion, guys, is nearly all completed in the small intestine. So the colon pretty much handles waste. Also, a lot of absorption of water. If it doesn't absorb enough water, you get diarrhea. Clinical conditions: intestinal obstruction, colostomy, hemorrhoids. Some people, guys, have to have, for any number of reasons, they have to do a colostomy where they make an opening, a stoma, and you have a plastic bag that has an adhesive ring on it that this is where you defecate into. Sometimes they do them temporarily, and sometimes they have to be permanent. My ex-wife, who died from cervical cancer, had to have one. And they do a good job with them, but they're not fun, but they're better than nothing. They're actually a lot better, guys, than what you might think. I'll put it that way. Okay, varicose veins. Remember that the veins, if the valves blow out, produces varicosities or varicose veins. If they're in the anal region, they're called hemorrhoids. So what's a hemorrhoid? It's basically a varicose veins in your butt. What's an enema? This will be our last topic because we're running out of time. Insertion of a tube in the rectum using water to evacuate the bowels. You fill it up, and then the person staggers over the toilet and lets it fly. They're used for therapeutic, but also sometimes to administer medication stuff too. Okay, guys, we're finishing up. When we come back, we'll continue right here. Dr. Tom will see you then. signing off for the moment.